This is not our data, so I don't want anybody to write this down and say, oh, this is what Google says their top searches are. We don't publish that except for in Google Trends on a more broad level, but this is external data. So the top 5 health searches for all search, this isn't just Google, is a disease or a medical program, a problem, medical treatment or procedure, certainly diet, nutrition, and vitamins are very big, exercise or fitness, and then prescription and over-the-counter drugs, and these aren't in order of search relevance. Again, just noting that 66% of people come to do a search for first, and only 34% are navigating directly to a website of their choice if they've bookmarked. So a little bit more on stats, and then we're going to move on. I think this is fascinating. If you think about where we are on the internet and social media and how it's driving consumerism, this is definitely going to start being more and more applied to health. We've got 200 million new users a year, and these are always sort of considered outside the United States. We're trending and looking at that a lot. The growth of content is just amazing when you think of YouTube. That's actually wrong. It's in the last couple of months, it's moved up from 10 to 13, which is what I suggested earlier. 70 million blogs, 50% are created by those that are 19 or younger. So I don't know what your kids are doing, but you should probably check on what they're blogging. And then I think this is really interesting. We're looking at data as a content online, and we're seeing that at least 20% of Americans that are using the internet have created some kind of user-generated content. And if you go look on YouTube and you search for online health diaries or I survived cancer, it's fascinating what people are uploading and what they want to share. And there's this new trend of people wanting to share their experiences and people actually learning from other people as opposed to people subscribing to sort of what we would call the allopathic or traditional Western medicine kind of institution. And this is really sort of where we think online management of health is going to go in trend. And then, of course, the support groups online. I'm not quite sure if that number is relevant now. I think that was a number that we saw about 6 months ago, and I think it's still growing. So, okay, what are personal health records? Does anybody here know what a PHR is? I'm seeing a lot of blanks there. So, a PHR is different from an EHR. Basically, how many of you today at home have a manila folder where you keep your bills and you essentially get your EOBs as evidence of benefits statements from your insurance company? You just basically dump anything that has to do with insurance or a prescription into that little manila folder. Raise your hand. Great. How many of you have a separate manila folder that is labeled kids with the same content? No, a couple. Okay, so basically you're throwing everything in one folder, right? Okay, that's what a personal health record is. The only difference is that it's now online. It's very similar to what you're doing with online banking, right? We used to be in a paper world. You get your banking statements and you stick them in a file somewhere, and you check them to make sure that the bank wasn't overcharging you or something. You checked it, get cash in the wrong account. This is what's happening with health. We're trying to actually take all of those papers that you don't understand, you have no idea what you're supposed to pay, why the labs are balance billing you, and we're trying to actually put that information online. We're not just trying to put administrative information and billing information online, because that's actually quite electronic. We're actually trying to do something more important. We're trying to put your clinical information online. So this means, what medications am I currently on? What medications were I on 5 years ago? Where did those prescriptions come from? What was the dosage? When I broke my foot 5 years ago and now I have really serious arthritis and I need to go see a rheumatologist because the arthritis is getting really bad, where did that x-ray go? Do I have to get another x-ray for that rheumatologist to look at, or can I actually give him the original x-ray? So these are the kind of things that we're thinking about. And a lot of people say, well, why is Google doing this? If anybody knows sort of what Google does, which is, our mission is to organize the world's information and make it accessible to all. It's a very grandiose mission, but Google's pretty good at grandiose. And basically, what we've thought about is, wow, we've done really, really good at taking offline content and putting it online. You guys have seen this with book search. How many people have used book search? Like 3 people? Wow, you guys need to read more. So we have 7 million books that have been scanned, and it's this whole sort of idea of trying to save books so they don't actually go extinct, right? Because we're all online anyways. But the idea is if we could actually scan those amount of books, think what we could do for actually medical records that are still paper-based. Now, Google Health is not a scanning initiative, right? Google Health is a personal health record that allows you to organize and store and share your medical records online. It's very, very early. I think Microsoft and Google and several others, WebMD's got a product. There's several of us that are sort of in the early curve of adoption. And there's all kinds of barriers, and we're going to get into that later on the panel.